thank you for the gift of life. And I thank you for the great community that you're expanding day in and day out. Abba Father, I pray take a lead in whatever thing that you're going to do today. Abba Father, I request that you add us more knowledge, wisdom, and understanding to clarify more issues in our lives. In the mighty name of Jesus Christ, I've prayed and believed. Amen and amen. So you can type in amen if you've prayed with us. There's a chat box down there. You can type in amen. And still for the comments, you'll be still sending in your comments down there. So it's exactly 2 minutes past 11. So allow me usher in a doctor, because this is a moment with a doctor. Allow me usher in a doctor by profession, a health worker, a nutritionist, a strong businessman who is going to be taking us through today's learning. And remember, today's topic is discussing proven natural methods for ladies to smile again. Ladies, it's time for you to smile again. So do not miss this session. At this very juncture, allow Dr. Roberts, I would request you unmute your microphone, you unmute your video, and please take over. Thank you so much.
Yes, greetings to you everyone, and hopefully you're doing well. For those of you who are seeing me for the first time, my name is Robert Semwez Masaka, a medical doctor, a nutritionist, and an entrepreneur. And I take this opportunity to congratulate our earliest bird, that is Madame Beatrice Rabera. You're welcome. You're one of the earliest bird for today's meeting. And I will request that if you can leave your videos on. This is a moment of interaction. We are learning from each other. And today's topic is one of the best topics that I've always shared. It is hope for ladies to smile again. And for those of you our guests for today, don't forget to subscribe to our YouTube channel, where you're going to be getting these updates. It's called HBMS TV. And we will be sharing more about health, more about nutrition, very many things. So if you want to be updated, just get to YouTube and subscribe to our channel. You can also click on the bell so that you can continuously get notifications every time we put something very vital. And God willing, next year, we will be streaming live for all our programs as they will be scheduled. So for today's sharing, this is a Friday. Every Friday we always meet from, we meet from 11 East African time, 11 p.m. to midnight. And I'm going to be sharing with you something very, very vital. If there are ladies on here, today is your day. Even to the men, it is our day. So straight away, I'll start with my sharing. It's about hope for ladies to smile again. And I want to bring it to your notes to assure you that a lady cannot smile if they cannot give birth. So our point of discussion today is going to be about infertility. And that is the channel you need to search on Google Meet, on YouTube, to be in position to follow all our programs, HBMS TV, Talking Health, and we are the Home-Based Medical Services International. We say health for all, but furthermore, we are the Visionaries International, touching lives for advancement. And my sharing for today would be hope for ladies to smile again. And I want us to look at what we call infertility. Infertility means not being able to get pregnant at least 1 year of trying. But they again further go ahead and tell us that or 6 months if the woman is over 35 years of age. If you're over 35 years of age and you've tried getting pregnant for over 6 months and you're not getting pregnant, we consider that to be infertility. And they go ahead to tell us that if a woman keeps having miscarriages, it's also called infertility. That is, if a lady is trying every time you get pregnant and you get a miscarriage, you get those abortions and all that, it was also considered to be infertility. So there is no way you can have joy, there is no way you can be happy when all that is happening to you. So where is the problem? When you look at the problem statement, it is the percentage of infertility versus the age. From the age of 18 to 31, we expect a woman to be super fertile, whereby you can be in position to get pregnant. So if you're failing, that simply means there is a problem. Then from 31 to 41, again, more 10 years, sterility starts setting in. Then in between that same age, that is when you expect to have what we call cycle irregularities. Today you see your periods, this month you see them, the other month you miss them and all that. Then at the age of 41 plus, that is when the menopause. Last time we were sharing about menopause, so more time we will be sharing more and more. These days it is becoming dangerous. Premenopause is becoming an issue, so hopefully we will be discussing also about that. But that is where the problem is. And when you look at the causes of infertility in women, it is a ladies' day for ladies to smile again. These are usually silent, undetected they are always undetected at times. And they include, number one, age. You can't rule out age with infertility. If you have questions, you can keep them coming. Then the other one is lifestyle, the way we lead our life. Then the other one is environmental factors, lead poisoning and other toxins in the body. Talk about diseases. Every time you find yourself all the time, you're getting chronic UTIs. You don't heal. You always have a foul smell coming out of your private parts, your vagina and all that. Just know you have an issue that can do with the infertility. Then the other one is physical problems, injury, or too much physical work. I've seen ladies who ride bicycles. At the end of the day, it can become a problem to you. Then the other one is hormonal imbalance. Talk about estrogen and then talk about progesterone and then prolactin. We'll be seeing that further. And they are telling us that high levels of prolactin in the blood can stop the ovaries from making hormones or the estrogen hormone, and low levels of estrogen causes irregular periods or stops periods completely. It even brings about reduced sexual. It even causes vaginal dryness, and at the end of the day, infertility comes in. And then the most important thing that we need to discuss is the hormonal imbalance. Most of the ladies who are failing to get pregnant, it is as a result of these female hormones. We have the prolactin, we have the progesterone, and then we have the estrogen. The moment these hormones are not balanced, you're going to find yourself in problems. And now, what happens? Let's look at the effect of hormones on fertility, the fertility rate. They're telling us that progesterone reduces the functions of estrogen by hindering the receptors onto which the estrogen attaches, thus hindering the ovulation. If you're not in position to go into your ovulation and all that, at the end of the day, you may find yourself suffering to get pregnant. Then they are telling us that, again, high levels of prolactin, high prolactin levels inhibit secretion of ovulation hormone, that is estrogen. So if your prolactin levels are high, your ovulation is suppressed. This is why when you look at women who are breastfeeding, they have high levels of prolactin and usually they do not become pregnant. That is why you've seen people go an extra mile to practice family planning using the natural method. Then they go further, tell us that estrogen increases the level of prolactin in the body, thus reducing ovulation. One gets irregular periods, mood swings, decreased sex drive, then headaches. All these usually show up after the age of 30 to 45 years when menopause is setting in. So that is the effect of hormones. And again, when you have hormonal imbalances and all that, expect things like ovarian cysts. These, at the end of the day, they are going to cause, again, infertility. You may fail to get pregnant and all that. When you look at the normal ovary, then you have the ovarian cyst, and then that is the normal vagina. Then again, another thing that is going to come in with that is the endometriosis, where the metry of the uterus is going to bulge and become big and all that. At the end of the day, it also affects your fertility rate. Then the other one is fibroids. This is very, 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 very common. I've seen ladies giving birth to fibroids bigger than those of the size of the baby. I don't know why these days we have high rates, but as we share on, you're going to be seeing why you have very many rates of fibroids. Out of 5, at least one has, or 2 out of 10, at least 2, 3, 4 people have fibroids of different sizes. So it is one of the things that has taken away ladies' happiness. You need to look at it critically. Then the other one is tubal blockage. Your tubes being blocked, you cannot also get pregnant. But at the end of the day, at the end of this sharing, you'll be in position to see that there can be a solution to all this naturally. And on the other hand, if I have men on here, I know Mr. Mwangi is on, men also have contributing factors. Gone are the days that every time a family would fail to have a child, the blame would be on ladies, they have stress and all that. But these days, even men are contributing at least 30%, 40% of a family failing to have a child. And things to do with the factors that are contributing, low sperm count, that is very, very common. Then abnormal sperm production or function due to undescended testicles, birth defects and all that. Then genetic defects or health problems such as diabetes. Then talk about things like infections such as chlamydia, gonorrhea, MAPS, even HIV. It also affects men the other way or the other way around. And then enlarged veins in the testicles, which comes out to be varicocele, also can affect the quality of sperm or no release of sperm at all. Then the other one is stress and anxiety of making someone pregnant or fear of the responsibility. If you've seen those young boys, at times they may fail to make a woman conceive simply because of the fear and all that. So also men have a contributing factor. If you have questions, you can keep them coming in the chat room. Then let's look at the causes of infertility in men. These are the major causes: sperm abnormalities due to STDs, sexually transmitted diseases. I've talked about diabetes. I've talked about varicocele, hydrocele. I've talked about obesity. I've seen men who are actually too fat, trying to have babies and all that, and they're failing. If you have your husband here, if you have your brother, we can help them out. Then the other one is hormonal imbalances. Also, men have that. Then toxins, and then heat exposure. Even men who sit on engines all the time, they're driving and all that. Then trauma. At times, it even brings about testicular torsion and all that. And then the other one, the risk factors is stress, obesity, caffeine, excessive use of caffeine, then alcohol, then smoking. Today I was seated somewhere, I saw a lady smoking like nothing. And I'm like, what is this? You know, a lot of things are happening in life, but all these things at the end of the day, they are going to affect us negatively. This is a lady you're going to find at a gynecologist place, trying to get pregnant, forgetting that this excessive smoking and all that is also affecting them. Then extreme exercises. It is always advisable you go and do workouts, but don't do it excessively. I want to thank you very much for attending today's session. I will not take it for granted, but every Friday, whether you're there or you're not there, we will be talking to those who are willing. This is a session that we put on Fridays. So in case all this will happen, you need to reach out for professional help. Then, not forgetting the environmental factors that negatively affect our health and cause free radical damage. The moment you have an accumulation of free radicals in your body, they are going to affect you in one or the other. And where do we get these free radicals? Talk about processed foods, chips, chaps, burgers, and all that. Ladies, this is as a result of you becoming vaginal, having a dry vagina and all that. At the end of the day, even when a man deposits sperm in your vagina, they cannot move to go and fertilize the egg. It affects us so badly. Then medicinal side effects. Then talk about air pollution, talk about water pollution, talk about health lifestyles, then talk about stress. Then the other one is when we are talking about medicinal side effects, Actually, I've seen people have been using family planning methods, and again to resume their fertility becomes an issue. That is why you need to talk to the person who invited you here, or you can even put in the chat room if you're a victim, and I can help you very well. If you've been using a family planning method and then getting pregnant is becoming an issue, this can help. We have a solution whereby we can wash out all those effects of the family planning and everything. Then let's look at the signs and symptoms of infertility. Number one to the ladies is failure to conceive. You've tried your level best and you can't conceive. Then number two, irregular periods. The average woman's cycle is 28 days long, not 35, not 28, not anything else. I've seen people going through that. Then painful or heavy periods. If you're here and you have issues with cramps and all that, you need to do something about it before you even know that you're infertile. Then the other one, no periods. It is not uncommon for women to have an off a month here and there. It is uncommon, it's not uncommon. Then the other one, symptoms of hormonal fluctuations. When we talk about hormones, this will be a topic for some other time, where we'll be discussing hormones, symptoms of hormonal fluctuation or imbalances. It can be by testing, but at times it comes with the stress, it comes with mood swings. You leave home with your husband, you left a wife very happy. By the time you go back home, somebody's annoyed with you out of the blue. All those mood swings and all that. Then pain during sexual intercourse is also an issue to do with infertility. Then when it comes to men, problems with the sexual function, for example, difficulty with ejaculation or small volumes of fluid ejaculated or reduced sexual desire or difficulty even maintaining an erection, erectile dysfunction. Then talk about pain, swelling or lump in the testicle area. Then recurrent respiratory infections. They also affect us men. Then low blood pressure. At times even high blood pressure, then failure to ejaculate or retrograde or none at all. It also happens. That is a sign of infertility. And now, the most important thing is the medical management. When you look at the medical management, infertility treatment depends on, number one, what is causing the infertility. Number two, how long have you been infertile? Number three, the age of your partner. You know, these days we've always had cross-generational, we call it cross-generational marriage. You find a lady is 25, a man is above 60. At times you find a lady is the boy is the gentleman is at the age of, let me say, 25, and now the lady, we call them sugar mummies and all that issue. So it also matters a lot. Then the other one is personal preference. But again, as I've always told you, that diseases don't read books. Some causes of infertility cannot be collected. I leave that to God. But again, when we come to the medical part, we have laparoscopy for blocked tubes. That one can work. They do an incision, they go inside there, then they open the tubes and all that. Then another one is laparoscopy and hysterectomy and iriscopy, all those. These are medical, then surgery. And I would recommend, if you're on this platform and you have chance to talk to somebody who invited you here, or it's me who invited you here, consider an operation as the last option. Why? I want to show you how to reverse infertility and get pregnant naturally. And what do you need to focus on? A few points here. Natural methods with food supplements. Don't take this for granted. So I want to bring it to your notice that taking antioxidants or supplements or eating antioxidant-rich food will improve your fertility rates. That is very, very vital. Then the other one is eating more calories at breakfast and fewer at your evening meals improves also your fertility rates. Then the other one, avoid foods high in trans fats. Then avoid refined carbohydrates as they raise insulin levels, which may increase the risk of infertility and make it harder to get pregnant. Then eating more proteins from vegetable source instead of animal sources. Then the other one, taking multivitamins also helps boost your fertility rates. Then avoid sedentary lives. That lifestyle, you need to avoid it. Then managing your stress levels can also increase your chances of becoming pregnant. As long as you know how to play with stress and all that, it is very good. You can also get pregnant. Then being either underweight or overweight, it reduces your chances of becoming pregnant. So you need to work on that very, very closely. And more antioxidants will give you high chances of getting pregnant. And where do we get these antioxidants? The key against free radicals is strong immune system. And how do you have an intact immune system? Is to take more antioxidants to neutralize the free radicals. The question would be, what are free radicals or what are antioxidants? When we look at antioxidants, these are specific nutrients in our food that prevent or slow the oxidative damage to our cells. And they act as free radical scavengers. They prevent and repair free radical damage. And when you look at phytonutrients, they act as antioxidants to help the body's defense against the free radical damage. These free radical damages, they end up even damaging the reproductive system and all that. And at the end of the day, you're going to find yourself having issues with your fertility rates. And how do we get antioxidants? We simply get them by feeding on health foods naturally. Over 5 servings of fruits and over 5 servings of vegetables on a daily basis. If I'm to ask how many of you, the 16 people, 17 people, has taken 5 fruits today? Or you've taken 5 vegetables today? Even those who try have done those that are genetically modified. You get the point? So it's at this point that if you want to have your fertility rate up there, you need to opt for a mega dose of antioxidants. A mega dose of antioxidants, where are you going to get this from? Very simple. You need to take high quality nutritional supplements that are going to optimize natural defense against diseases. They even boost your immune system. They provide you with the nutrients, vitamins, and minerals at optimal levels. And more importantly, they're also going to act as cleansers and detoxifiers in your body for you to increase your fertility rate. If you're on this platform and you're taking drugs, let me say you have a chronic illness or what, you need to do something about it. Simply because the more you're taking in these drugs, TB drugs, and what have you for chronic illnesses, you are again affecting also your fertility rates. And at this point, I want to introduce to you the next generation nutritional food supplements from Nature's Way. Nature's Way is a multi-billion US company that has been into existence now for over 60 years. It has different doctors, medics, who know that the best way you can treat somebody, even to increase their fertility rate, is to use food supplements. And it's at this point that I want to talk about this product here, which is called C24/7. C24/7 simply means complete nutrition, 24 hours, 7 days a week. It contains over 22,000 plant nutrients and antioxidants in one capsule. And more importantly, it has over 29 vitamins, minerals, and trace minerals. It has 18 amino acids. It has over 14 supergreen foods. It has over 12 whole food juice blend. It has over 12 whole vegetable juice blend, 12 mushrooms, 12 digestive enzymes, 12 herbs and special nutrients, 10 essential fatty acids, 5 anti-aging and antioxidant enhancers, and 4 longevity peripherals and mega reversal brands. One of the things that used to keep our grandparents, I know of my grandmother, she gave birth to 11, 12 children, very strong. This is what they used to feed on. Nowadays, if you can't access them, you need to supplement so that you can have your body intact, give birth to as many children as you can, but you remain strong. And when you look at this product here, it does what we call cellular protection, cellular immunity, cellular energizer, cellular enhancement, cellular support, cellular nourishment, cardio protection, and cancer protection. It is awesome. And now it goes ahead to prevent major complaints or major conditions that would prevent you from getting pregnant. For example, it promotes longevity, lifespan, then protects against heart disease and heart complications. I'm sure you've heard about hypertension that comes with pregnancy and all that. It prevents cancers of any organ, controls high blood pressure, enhances metabolism and proper digestion. It enhances and strengthens the immune system. It detoxifies the body, reduces fatigue, depression, and anxiety, It even enhances sexual vitality in both men and women. It helps in the regeneration of liver cells. It is good in healing of fractures. It even rejuvenates the skin and controls blood sugars. That is C24/7. And when you look at our other products, we have very many of them. These are some of them to mention but a few. We have the Burn Slim, Live and Burn Coffee, Restore Life, Coledus. By the way, Coledus is very good for you when you're pregnant, even when you're looking at getting pregnant. Omega-3 fish oil combined with vitamin E plus DHA. Then Complete is also very good. Then Vidamax, talk about the living alkaline coffee, decaffeinated alkaline nature. Then talk about MyChoke and the Kiddy 24/7. All these are wonderful products. And now the point is here. Hope for ladies to smile again. Restore your ability to get pregnant and be able to carry your baby to term using natural proven products. If you've been battling for a year and you've not gotten pregnant, they've done tests here and there. This is what you need to get to yourself. It is a 40 days. You just need 1 packet of Restore Life, 2 packets of C24/7, then 4 boxes of sugar-free. With Restore Life, you'll do 1 time was 1 for 30 days. Then C24/7, 1 time was 1 first week, 1 time was 2 second week, 1 time was 3 third week. Then sugar-free, you do 1 time was 2. That is for somebody you're battling fibroids, you're battling cysts, you're battling hormone imbalance, you're battling anything. You start on this. But anyone who is in that childbearing age and you've not fallen a victim, I recommend you put Coledus, Complete, and then the sugar-free. This will give you a chance for you to smile again. It is ladies, hope for ladies to smile again. And as I come to the end of my sharing to answer a few questions here and there, I want to thank you very much for attending. I want to share with you a story of Miss X. That is not her exact name. This is the lady who said it's okay. You can share my story as much as you can because she's enjoying the benefit of what I've shared with you. Madam X, that is her firstborn. 19 years, she's a mother. That is the firstborn. 6 years back, that is the mother. She used to have a lot of discomfort, enlarged tummy, too much pain, continuously bleeding day in, day out. There is a time she told us she bled almost to death. When she's sharing her story, you can even cry. What was her issue? She had multiple intramural fibroids. These are her medical forms, whereby you had all advised, let the fibroids grow bigger, then she can go for surgery. This is what she had in her tummy. These are different forms of fibroids. Ladies, you can even have a fibroid that can even protrude through the vagina. Different types. And this is what she used to go through. These are signs and symptoms. You know, as Africans here, you wait when you're on your deathbed. That is when you want to do a checkup. You have that low abdominal pain, frequent urination, pain during sexual intercourse, lower back pain, constipation every time you go to the toilet, then chronic vaginal discharge every time you remove your panty, it is stained. All those are signs. She even used to have miscarriages. Just like I told you, her firstborn is 19 years. But before, after she had gone through hell, she had opted for surgery. But before surgery, she gave herself a chance to try out these products as I've shared them with you. With much focus on C24/7, look at all the ingredients that are in C24/7 that are going to help you cleanse your body, detoxify your body, and all that. And by the year 2018, that was Madame X. That is how she was looking. Surprisingly, not operate her, but fibroids shrinked one by one, and they came out. But one of the most memorable thing is the year 2020. When she got pregnant, I saw her celebrating a baby shower. This is Madame X here, carrying a baby to term. Can you imagine? Every time I look at her story, I say diseases don't read books. Madame X here, this is the firstborn, the one you see behind her. And here comes the secondborn. Can you imagine? She had looked for baby, and the baby was nowhere to be seen. But courtesy of the products that I've told you, with the guidance that we gave, she managed to give birth after 19 years. There are very many other ladies who are okay with sharing their stories because these products have done wonders in their lives. Other testimonies of C24/7 and other products. Look at breast cancer before and after using products. Look at diabetes. This is a diabetic foot. The before and after. Look at goiter, thyroidism disorder. These products can do wonders. I want to thank you very much for following through, and I've come to the end of my sharing. And anyone who would want to have more about this program, you'll find it on our TV channel, that is HBMS TV. We will be sharing the link in the chat room so that you can be in position to follow. You can go just subscribe HBMS TV Talking Health. Then you also click on the bell so that you can always get notifications about our programs. Thank you very much for following through, and back to our host so that we can coordinate the questions as we come to the end. Thank you very much, and may God bless you.